Thank you. I want to start by conveying my respect and gratitude for those essential employees who are on the front lines of public safety, and realize that your safety is our top priority as we deal with a very fast changing situation that has many people worried for good reason, and that I'm happy to give you the best information I have on how to keep yourself safe. Sure. So when we think about controlling the spread of an infection, I know a lot of people are very focused on masks and personal protective equipment, but really protection starts at the administrative level. So that, for example, is if you're taking a call or you're having to interact with a member of the public, just asking and seeing if they look ill. And so that's administratively collecting information before potentially having closer contact. The next level is environmental, and that's when you maintain a 6-foot distance, which is considered about the length of a bicycle, and that is also considered protective. Also, being outdoors is another environmental control, so conducting anything outside, again, maintaining about 6 feet between you and whoever you're with is protective. And then finally, the last resort is the mask or gloves or eye protection that is part of the personal protective equipment, and that is really for healthcare level close encounters with people who have respiratory symptoms. So we use the terms close and prolonged contact as a risk for transmission of COVID-19 because we know that it can spread in households. So at that level of intimate contact is where we think it spreads. On the opposite end of the spectrum, we know that passing contact is really not a risk of spread. So it depends on how long you're with that person and what the closeness is. So for example, a household member living under the same roof is at risk for infection by virtue of the time they're spending with someone who's ill. A healthcare worker who is doing a procedure that is creating droplets and aerosol right next to their nose and mouth would need to take protections even for that brief encounter because of the nature of the risk. So there's no clear definition for this. I would say it's somewhere in the realm of an hour, maybe less, depending on if it's a smaller space with poor ventilation and someone is coughing a lot. It would be closer to the hour in a larger indoor space with decent ventilation, but that's one working definition that we're using of the close and prolonged. So depending on the circumstances, it could be it could be passing, it could be prolonged. I would say that's a great chance to use the environmental controls. So again, your officers standing outside, maintaining a 6-foot distance, looking to see if the person appears unwell. And then for any exchange of items, making sure the officer does really good hand hygiene, following and making sure not to touch his or her eyes, nose, and mouth would be really important. So they might start again with collecting information. That's the administrative control again, collecting information to see if there's any reason to think that the decedent had respiratory symptoms before dying. If that's not possible, they can go and again maintain a distance if they can to see what information they can get from 6 feet away. If they need to touch the body, they should use touch precautions, wash hands really well, and avoid any action that would compress the chest and potentially create the equivalent of a cough. So I would say when interacting with a member of the public, first, if you're face-to-face, if there's any way to just conduct that interaction outside, if that's practical and maintaining the 6-foot distance, that's a great way to start. If that person appears obviously unwell, like they're coughing, and you need to have a closer interaction with them, you would want to make sure that they had a mask to contain their droplets and secretions. And then if you have to have really close contact with someone with those types of symptoms, you would want to wear personal protective equipment in accordance with our current infection control guidance. Correct. So that's covering eyes, nose, mouth, using gloves, a gown if it's available, and then always good hand hygiene afterwards. I would say no. I would say in that circumstance, I would hope that officers would feel comfortable that between being outdoors or within a 6-foot distance of someone who's showing no symptoms and they're doing good regular hand hygiene, I would say that would not be a reason to wear personal protective equipment. I would say it's really not needed, and given the supply situation that we're in, that would prioritize and keep those supplies for those closer and higher risk interactions that either officers or healthcare workers, EMS responders are having. So you'll see EMS responders erring on the side of personal protective equipment because they are in the field. They are, by definition, responding to sick individuals and having very close contact with those individuals. So actions like CPR, other manipulations of people's airways, those would be considered high risk for COVID-19 transmission. Right. So risk of disease transmission is never zero, but for that scenario, I would say that is passing contact, and again, maintaining that 6-foot distance. I personally would feel comfortable having that kind of interaction without additional precautions. Yeah, so some of the easy things to do just routinely to keep yourself safe is to wash your hands regularly, disinfect gear that you're using regularly. That might include patrol cars. And the COVID-19 virus is easily killed with most disinfectants and household cleaners, so check the label. But that kind of routine disinfection of high-touch surfaces can be helpful. That is true. Soap and water is always best. Hand sanitizer also works for this particular virus and may be more convenient and is certainly better than nothing at all. For an otherwise routine encounter with someone who is obviously sick and coughing, masking that person who is coughing is definitely the first step. And then maintaining that 6-foot distance if at all possible. If you know you're going to have close contact, taking additional precautions, eye, nose, and mouth coverage, gloves, and really good hand washing following. Absolutely. If there's any question that that person is seriously unwell, that's a call to 911 with advice that they are exhibiting respiratory symptoms, so that our emergency medical services workers can come in protective equipment and take it from there. So in that instance, I would say the ill person should definitely have a mask. They should be in the back seat. The windows should be down, and I'm assuming a short ride along the order of 10, 20, 30 minutes, no more than that. Yeah. So the officer should then disinfect the car following and wash hands really well. So people ask, why not err on the side of wearing personal protective equipment for every encounter with the public? There's a couple of reasons why not. The first is that we are in a state of short supply, so we have to prioritize that protective equipment for those at highest risk, which are really healthcare workers having intimate healthcare level contact with patients who are exhibiting this illness. The next is that there are other things people can do to keep themselves safe, and that's where we talk about the 6-foot distancing, trying to have interactions outside, and again, trying to gather information before going into a situation where you might be able to take additional precautions. So public health is working really hard on a fast-moving situation that has a lot of elements to it. We take very seriously the safety of law enforcement. We have a dedicated law enforcement liaison. We are working hard to align across the metro area counties for a consistent message, and again, our best advice based on the situation as we understand it today.